So good evening, everyone. I am Dr. Praveen Kumar Etta, consultant nephrologist, kidney transplant physician at Virinchi Hospitals, Banjaras, Hyderabad. Today, first of all, I would like to wish you all a very happy New Year, 2020. Today, we discuss regarding hypertension. So this is a live program. So while discussing, we answer a few questions which are asked by the audience. So what is meant by blood pressure, first of all? So blood pressure is the pressure exerted by blood column on the walls of the blood vessels in the circulatory system. So the blood pressure is denoted by systolic blood pressure and diastolic blood pressure. Systolic blood pressure is the maximum pressure that is exerted or that is identified during the systolic phase of the cardiac cycle. Systolic phase means when the heart contracts or the ventricles of the cardiac chambers, they contract. That is the systolic phase of the cardiac cycle. So that is a pressure, that is a maximum pressure during when the heart contracts, that is the systolic blood pressure. And diastolic pressure is the pressure when the heart in the relaxation phase. That is called the diastolic phase of the ventricles. That is the minimum pressure that is present in the circulation. That is the diastolic pressure. So what are the normal ranges of systolic pressures and diastolic pressures? So as per the various guidelines, both American and European guidelines, the normal blood pressure is usually considered as systolic pressure of less than 120 millimeters of mercury or diastolic pressure of less than 80 millimeters of mercury. So less than 120 systolic, less than 80 diastolic are usually considered as normal for the adult. In children, the blood pressure varies according to the age. So as the age progresses, the blood pressure usually increases. So by 17 or 18 years, they reach the adult level. So in children, this 120/80 should not be considered because their pressures are usually much lesser than the adult level. So only in adults, less than 120, less than 80, systolic and diastolic are considered as normal. And what is hypertension? So hypertension is sustained high level blood pressure above a level. So the level is usually in various guidelines, they say that systolic pressure of more than 140 millimeters of mercury or diastolic pressure of more than 90 millimeters of mercury are considered as hypertensive range. And between 120 to 139 systolic and 80 to 89 diastolic, they are usually considered as pre-hypertensive range. That is the before the hypertension, the blood pressure is going up. That is the pre-hypertensive range. So in these individuals, with better diet modification and lifestyle modification, we can control the blood pressure level. Usually the medicines are not required at this stage. And once the blood pressure reaches the threshold level of 140 systolic or 90 diastolic, usually they require medicines along with diet control and lifestyle modification. So because they are falling into the range of hypertension. So somebody asked the first question. So what is meant by ABPM? So ABPM is a newer concept. That is, the full form is ambulatory blood pressure monitoring. So normally what we check the blood pressure at hospital, that is called as office blood pressure measurement. And if you check the blood pressure at home with your home instrument or the digital meter, it is a home blood pressure measurement. So what is ABPM is ambulatory blood pressure monitoring, where the instrument is attached to the human body, and the instrument or the BP instrument, it regularly checks the blood pressure. During daytime, it usually checks at 15 minutes to 30 minutes interval at several time points. And in night time, while the patient sleeps, it checks at half an hour to 1 hour intervals. So throughout day and night, it checks the blood pressure at different intervals of time. So it gives a like blood pressure readings over 24 to 48 hours period continuously. So this is a newer concept which has been practiced in Western countries for last several years. Even in India, where we are practicing in difficult control situations, or when the hypertension diagnosis is not certain, we have to use ABPM monitoring. That is the ambulatory blood pressure monitoring, which is nothing but measurements of blood pressure at different time points throughout day and throughout night time by attaching an instrument to the human body. That is the ABPM monitoring, which gives an accurate idea of how the blood pressure is behaving in a single patient and we can accurately diagnose several disease entities. So the second question we take, so why do we check the blood pressure in lower limbs? So that is a good question. Usually we check blood pressure in the upper limbs. This 140, 90 or whatever we have discussed till now is with particular to the upper limb blood pressure measurement. So lower limb blood pressure is also important in certain situations, especially in a disease situation called coarctation of aorta. So coarctation of aorta is a condition where the aorta is a larger blood vessel coming from the heart, so where it gets narrowed. So in coarctation of aorta, because of aortic narrowing, the blood pressure in the upper limbs goes up, but in the lower limbs it falls down. So normally the blood pressure in the lower limbs is higher than the upper limbs in normal individual. So, but in coarctation of aorta, which usually occurs in young adults. So, if a young adult is found to have hypertension, by identifying the high blood pressure recording in the upper limbs, you have to rule out coarctation of aorta by measuring the blood pressure in the lower limbs also. Because if the lower limb blood pressure is less than the upper limbs, you have to suspect coarctation of aorta in these patients. So, that is the important role of blood pressure in lower limbs. Okay, another question we'll take. What is the role of blood pressure measurement in standing position? So, okay. So, normally we measure blood pressure in normal routine individuals or in hospital in sitting position or in lying down position. That is a normal. So, in some conditions, what is called as orthostatic hypotension or orthostatic hypertension, where the blood pressure either falls or it goes up in standing position. So to identify those specific disease entities, we need to check the pressure in standing position also. Like for example, in a diabetic patient of long duration, if they have some form of disease like called as autonomic neuropathy, the blood pressure falls down while standing. So whenever the patient stands up, the blood pressure falls down. So these conditions can be identified by checking the blood pressure in standing position. That condition is called as the orthostatic hypotension. Okay, next question is, so what are the types of hypertension? Okay, so types of hypertension. So actually there are different types of hypertension. Hypertension we have discussed. Hypertension is nothing but sustained high level blood pressure above a specific range, usually 140 systolic or 90 diastolic. So what are the different types? So sometimes the first type is isolated systolic hypertension, where only the systolic blood pressure, that is more than 140, the systolic blood pressure goes up, but the diastolic blood pressure remains normal. Or in some situations, isolated diastolic hypertension occurs, where the diastolic blood pressure, that is more than 90 of diastolic, leads to diastolic hypertension, but systolic will be normal. So these are some types, and some important types include white coat hypertension. White coat hypertension, as the name indicates, it's a hypertension or the high blood pressure recordings in the hospital in front of the doctor. So whenever they see white coat that is weird by doctor, they feel anxiety. So they feel anxious. So the blood pressure goes up. So whenever the BP is measured in the hospital, it is usually in the high range. But whenever the BP is measured by some other person or at home, usually BP will be normal. So this condition is called white coat hypertension. This is because of the anxious environment in the hospital. By seeing the doctor, the blood pressure shoots up. That's called the white coat hypertension. Another specific type is the masked hypertension. It is opposite that of the white coat hypertension. Masked hypertension is hypertension or the high blood pressure recordings at home. That means whenever he checks at home, it will be high, and in the hospital it will be low. So that is the opposite of the white coat hypertension. It's called as masked hypertension. Why it is called as masked? Because it cannot be diagnosed routinely, because whenever the BP is checked in the hospital, it will be normal. So they don't check usually, but accidentally when they check at home, it is usually high. So these are usually masked unless they check routinely by routine screenings or routine health examination or routine tests. Then only it can be identified. So this is called as the masked hypertension. And other several types of hypertension are there, like hypertension with urgency, emergency, crisis, and all those things. That we'll discuss if somebody asks question. So next question we'll take. Next question is how common is the hypertension? Okay, this is a very good question. Actually, hypertension is very much common. Actually, we have done a study in general public. We have checked the blood pressure of almost 2,000 individuals of normal general population, and we have to our surprise that we have identified hypertension in almost 25 to 30% of this normal general population who are not aware of their disease in the past. That means the burden of unidentified or undiagnosed hypertension is very high. In other studies also it has been identified by that almost 30% of the general population in India are having hypertension which is not undiagnosed, which means the patients themselves they are not aware of hypertension. Okay, it is only the routine screening test identifies the hypertension. So it is a very gravity of the situation is very high in these cases. So hypertension, the various authors say that there is a rule of 50. What is the rule of 50 in hypertension is almost 50% of hypertensive patients are undiagnosed, and remaining 50% who are diagnosed, only 50% of them they take the actual treatment, and out of them only the 50% of the patients who received the treatment they have adequately controlled hypertension, and that means almost only the 12.5% of all hypertensive patients they have actually well controlled hypertension with medicines. Remaining all a very large chunk of patients they are either having undiagnosed hypertension or uncontrolled hypertension with the drugs because of not following the drugs, not following the doctor advice properly. That is a situation. There is a rule of 50 in hypertension. So we'll take up the next question. Who are the persons going to get affected with hypertension? So if you say the risk factors of hypertension, so it is most important risk factor is the age, because the hypertension usually occurs when the age usually more than 50-55 years. It is called the essential hypertension. So age is one of the most important risk factor. Other risk factors are there, like genetic factors are there, like if a family member, mother or father or sibling is having hypertension, there is higher chance of getting hypertension for that patient. And other risk factors like excessive salt intake or obesity, that is the excessive overweight, or when the BMI or body mass index is more than 30, that is the obesity. So that is also one more risk factor. And smoking, excessive alcohol intake, and they're all important risk factors. And most important risk factor is the kidney disease. As we are nephrologists, we see a lot of cases of kidney disease patients, and almost all of them they have hypertension. So hypertension, because kidneys are the main organs in the body which control body fluid levels, electrolyte balance, sodium balance, and everything is controlled by the kidney only. So whenever the kidneys get damaged or when the kidney failure occurs, the hypertension is usually prevails. That means hypertension is very common in kidney disease patients. And hypertension usually, there are actually two major types of hypertension. One is essential hypertension. Essential hypertension is usually age-related hypertension. Usually occurs after 45 to 50 years of age. It is because of age-related changes in the blood vessels. Because of thickening, calcification in the blood vessels, the blood pressure shoots up. That is the essential hypertension. Another group of patients which contribute much lesser percentage of patients, that is usually 10% of patients. Essential hypertension usually contributes to 90% of all hypertension patients. So remaining 10% are considered as secondary hypertension. Secondary hypertension is nothing but hypertension because of some other underlying disease. So this secondary hypertension is much more common in children or young adults. Essential hypertension, which is much more common, usually occurs in age group, old age group. And the secondary hypertension, which is less common but is more commonly seen in young patients, young children or young adults, because of some underlying disease leading to the hypertension. And most important disease for these cases is because of the kidney disease or kidney failure. And some other causes include thyroid disease, parathyroid disease, or some hormonal imbalance like growth hormone excess, that is called growth hormone excess, or adrenal disease. Adrenal gland is one more endocrine gland which can cause Cushing syndrome or hyperaldosteronism or Cohen's syndrome. So these are all the important causes of hypertension secondary to some underlying cause. But most important thing is, remember, the kidney disease contributes to the most common causes of this secondary hypertension, and is the most common cause of secondary hypertension in children. Okay, so next question is, what are the complications? What are the complications of uncontrolled hypertension? Somebody is asking about complications. So complications, as I said you, the hypertension is a pressure exerted in the circulatory system. So whenever the hypertension is not under control, it affects almost every organ of the body. The most important 5 organs which are affected by the uncontrolled hypertension are: one is brain. It can cause stroke, that is, which is called as a cerebral stroke, or it can lead to the paralysis. Usually we see one upper limb or one hand or one leg gets paralyzed. So this is called as hemiplegia, the stroke. That is a one more adverse effect of the hypertension. And the second, it can lead to the dementia. That is also affects the brain. So stroke, brain, they affect the stroke and dementia and memory loss. All these things are because of the brain effects. And second is the eyes. Eyes are affected by the hypertension. It can lead to the bleeding into the eyes. Sometimes sudden vision loss can be because of uncontrolled hypertension. Okay. Third important organ is the heart. It can lead to the coronary artery disease, which is called as heart attack or heart failure. So, and the fourth important organ that is affected is the kidney. So hypertension affects the hypertension leading to the kidney failure. Actually, hypertension and kidney, they are actually interlinked. It's actually a vicious cycle. So what is a vicious cycle? When the blood pressure is uncontrolled, it can lead to the kidney damage. And kidneys, as I said, it is the most important organ which controls the body volume and also the electrolytes and the sodium balance. So when the kidney gets damaged or failure, it going to the failure stage, it further leads to the hypertension. So hypertension, kidney, again kidney damage leading to the hypertension. This cycle continues. This is the vicious cycle. And the fifth important organ, that's called the important complication, is the peripheral vascular disease, which is because of the blockage of the blood vessels because of the uncontrolled hypertension. That it can lead to the blockage of the blood vessels, leading to the sometimes it can lead to the gangrene of the limb. So which can lead to the amputation sometimes. So 5 important organs can they are mainly affected by the hypertension. But as I said, almost every organ can be affected by uncontrolled hypertension because the circulatory system circulates throughout the body. So control of hypertension is most important. Along with diabetes and hypertension, these two are the more important things to control with regard to the cardiovascular disease. Okay, so next question we'll see. So hypertension because of kidney disease. Okay, so hypertension, as I said, hypertension and blood pressure and kidney, they are actually interlinked. Both hypertension uncontrolled can lead to the kidney disease, and kidney disease can also further aggravate the hypertension. So this cycle continues. So many kidney disease, they cause hypertension mainly because of the imbalance in the body homeostasis, because of loss of control of body volume or the control of on the sodium and potassium levels. Most of these people, they get hypertension. And the most important system that gets affected is called as the renin-angiotensin system. So this renin-angiotensin system is actually, the kidneys are the main vital organs which produce the renin. So this renin-angiotensin system mainly is under control of the kidneys. So when the kidneys get damaged, this renin-angiotensin system gets activated, lead to the hypertension. So kidneys diseases and hypertension both are very much linked to each other, and it can lead to the vicious cycle of hypertension and kidney failure. Okay, so we'll see the next question. So what is hypertensive crisis? Okay, so hypertensive crisis is actually a medical term which you may not all aware, the general public may not aware about this term crisis. So actually hypertension previously is the severe hypertension, severe level of hypertension is categorized as 2 major types. One is hypertensive emergency, another is hypertensive urgency. Okay, so hypertensive emergency is a situation, usually blood pressure, systolic pressure of more than 180 and diastolic pressure of more than 110 with usually associated end organ damage. As I said, end organ damage is because of it can be because of damage to any of the important organs. As I said, there are 5 important organs which get affected by hypertension: brain, heart, eyes, kidneys, and peripheral vessels leading to the lower limb ischemia. So these 5 important manifestations of hypertension, whichever is there, is called as end organ manifestations. So severe level of hypertension with end organ damage is called as a hypertensive emergency. So in these situations, we need to control the blood pressure very rapidly, and patient needs to be admitted, and we have to give drugs, not only the oral drugs to control blood pressure, we can give intravenously drugs to control blood pressure rapidly. That is the hypertensive emergency. Another term is the hypertensive urgency. Urgency is little less severe condition where the blood pressure is also at the severely high level, usually 180 systolic or 110 diastolic, but usually without end organ damage. This condition is called as hypertensive urgency. Nowadays, the guidelines, they do not differentiate urgency and emergency, and they combine these two terms into one category, that is the hypertensive crisis. And one more term is malignant hypertension. This is also a similar situation of very severe high level blood pressure level, hypertensive malignant hypertension, which can lead to the various types of end organ effects. So that is a hypertensive urgency, emergency, crisis, or malignant hypertension. Now all these terms are actually, they are interchanged actually. Absolutely speaking, actually these are different definitions of these terms, but as a layman you can interchange these terms, and they indirectly indicate a very severe level of hypertension. Okay, so next question is, so what is DASH diet? Okay, somebody is asking about DASH diet. DASH diet is actually, I think, is a medical person. So DASH diet is usually not known to the normal general public. DASH is DASH. So DASH diet is nothing but dietary approaches to stop hypertension. There is a DASH diet. This acronym is by the American Society of Hypertension. They have given DASH diet. So for hypertension, as I said, along with medicines, we need to control the diet, and also certain lifestyle modification need to be followed. So within the diet, the important diet is the DASH diet, and some other diets like Mediterranean diet is also helpful for hypertension. So what is DASH diet? Dietary approaches to stop hypertension diet. This DASH diet is mainly a diet rich in fruits, vegetables, and it should be less fat. That is, low fat dairy products can be used in the DASH diet, and it should be devoid of or very low in saturated fats and trans fats. So diet rich in fruits and vegetables with lesser salt and lesser fat is the actual DASH diet. This has been described by American Society of Hypertension, and this DASH diet is very much useful to control hypertension. It is rich in potassium and low in sodium, so thereby it controls the blood pressure levels. Along with DASH diet, the actual recommended salt intake for treatment of hypertension is, as per the WHO, it is 5 to 6 grams of salt per day. So 5 to 6 grams comes to around, the salt of 5 to 6 grams comes to around 2 to 2.4 grams of sodium. That again comes to 80 to 100 milliequivalents of sodium. So the actual recommendation as per the WHO is up to 100 milliequivalents of sodium or up to 6 grams of salt per day. But what we usually in our diet, what is the salt content? You know, anybody know? So normal salt content of normal average Indian adult is almost 10 to 15 grams per day. So see how much we are consuming the salt. So the salt intake of normal food is very much high actually, above the recommended level. So the recommended level is only 5 to 6 grams per day. So that is an important thing. And there is continuation of or initiation of exercise is also important to control hypertension. It is recommended that 20 to 30 minutes of brisk walk per day, and almost all days of the week, or at least 5 days in a week is recommended. That is according to the guidelines. So diet control, salt intake, restriction of salt intake, and exercise, and reduction of body weight. This is also very important because obesity contributes to hypertension. 10 kg weight loss contributes to up to 5 to 6 millimeters of mercury reduction in blood pressure level. So blood pressure, so obesity and blood pressure are interlinked. So weight reduction is also important, and avoidance of smoking, So smoking is a very bad thing. Complete stoppage of smoking is recommended. If at all patient is addicted for smoking, we can prescribe them chewing gums or nicotine patch. Thereby they can get rid of smoking habit. And if at all if the patient is alcoholic, the alcohol intake can be reduced. So all these things are helpful to control hypertension. Okay, these are all the diet and lifestyle modifications for control of hypertension. Okay, so next question. So so what is the contribution of nephrologist to the treatment of hypertension? Okay, so actually the hypertension, as I said, kidneys play a vital role in control of body homeostasis, control of fluid balance, control of acid base balance, control of electrolytes, control of sodium, potassium. All these things are done by the kidneys. Actually in the body, the total homeostasis is done by the actually by the kidneys. So kidneys are important for control of blood pressure, and kidneys, as I said, it is also important for production of certain hormones. As I said, it is the renin angiotensin system that controls the blood pressure level, and the renin is produced by the kidney. So kidney failure patients, as I said, they are all at a higher risk of hypertension. So almost we see routinely many kidney patients, and almost all the patients, they have hypertension. And in Western countries like America and all, the hypertension specialists are actually the nephrologists. So nephrologists, they take a major role in controlling or in running the hypertension clinics. So they are considered as the actually hypertension specialist. But in India, the people may not aware much about nephrologists, so they go to cardiologists mainly for control of hypertension. But nephrologists also play a major role in controlling the hypertension. And in our kidney patients are actually having very high levels of blood pressure, which are difficult to control also. Sometimes we use even 4 drugs, 5 drugs also. So the routine blood pressure that occurs according to the in old age patients is usually a simple blood pressure which can be controlled with 1 or 2 medicines. But when there is kidney impairment or kidney disease, the blood pressure is usually high and is also difficult to control. We can use almost 5-6 drugs also sometimes. And in the few dialysis patients who are on dialysis, they have very high levels of blood pressure, up to 280 systolic also. So these difficult to control hypertension we see very routinely. So we treat them routinely, and so we have very much experience of treating hypertension in these cases. So that is the role of nephrologist in controlling in treating hypertension, because we come across this hypertension very common in our patients. So we in day-to-day practice we see many hypertensive patients, along with also diabetic patients also we come across. So we are all experts in treating hypertension. Okay, so next question. So what are the treatment options? What are the medicines for treating hypertension? Somebody is asking. So actually we have different types of drugs for control of hypertension. So the 4 major categories of hypertension medicines include, mainly you can remember them as A, B, C, D. A is it's actually medical terms. A is AC inhibitors or angiotensin receptor blockers. So this is a A group. B is beta blocker. C is calcium channel blocker. D is diuretic. So coming to the A group, as I said, it's a AC inhibitors or ARBs, or that is angiotensin receptor blockers. As I said, renin angiotensin system plays an important role in control of hypertension or the blood pressure in normal individual or in hypertension patients. So these AC inhibitors or angiotensin receptor blockers, they are act by blocking this renin angiotensin system. And coming to the second class, that is beta blocker. Beta blockers, they act by blocking certain receptors of the sympathetic nervous system. These receptors are beta receptors. So these are called beta blockers. Beta 1 is situated in the heart. So in beta blockers also we have selective and non-selective blockers. And calcium channel blockers, these calcium channels are situated in the blood vessels. So these calcium channel blockers, they block the calcium channels situated in the vascular blood vessels. So these calcium channel blockers, they prevent the contraction of the blood vessels by blocking calcium channels. So these are calcium channel blockers. Diuretics are the drugs which can cause excretion of sodium and other electrolytes from the kidney. So these diuretics, they act at the level of kidneys. So these four major classes of drugs, A, B, C, D, you can remember them. And there are other classes of drugs also, like prazosin, which is called as alpha blocker, or which is clonidine, which is actually centrally acting antihypertensive drugs. So they are all the minor classes of drugs, but major class of drugs are A, B, C, D. Okay, so so I think time is up. So we'll end this topic. So friends, hypertension is very common in India, and most of these cases they are actually undiagnosed. So uncontrolled hypertension can lead to the various complications. It can lead to the end organ damage. So beware of hypertension. You have to check your blood pressure routinely. After the age of 40, it is recommended that at least once a year you have to do routine tests, including blood pressure measurement, to identify the blood pressure or the hypertension in early stage. So friends, thank you all. We'll end this topic here. Thank you very much.